Welcome, everyone, to episode 4 of the Rehab Revolution. Super exciting episode we have today. We're going to talk a little bit about inside the toolbox, and we're going to learn a little bit more about the most effective physical therapy techniques that Dr. Gariffo personally uses in his practice. We're going to go beyond the basics and explore specialized methods, including some of what we've talked about on our previous episodes, but hyperbariatric oxygen therapy, dry needling, manual therapy, and of course, there'll be more. And we're going to learn a little bit more about some additional techniques and who benefits specifically from them. So I know I'm super excited to learn more about this. Are you excited, Dr. Grifo?
Yes, let's do it. Really
And
excited.
speaking about exciting things, I definitely have to point out that you're doing super well on Apple charts, top
Saw that.
10 in the fitness category in almost 3 countries, which is amazing. We're number 9 in the Netherlands, 11 here in the US, and number 12 in Germany, and that is super exciting.
That's wonderful news.
Absolutely. I'm so glad that we're doing so well and everyone's learning all about your special techniques. And yeah, I'm excited to learn more today. And I love the logo on the back, by the way.
Yeah, I wanted to mix it up a little bit. I'm here at the clinic today, so I was figuring might as well share the logo, right, with the world.
Absolutely, absolutely. I love the logo. I love how colorful it is. And I had a special opportunity to see a little bit of the rehab room prior to our study or call. So excited for that in the future. It's a super nice clinic. And we'll definitely make sure to have the listeners and viewers get to see a little bit of more about that in a later episode. But for today, I'm ready to jump right in with some questions for you. So, Dr. Grifo, I know a lot of people think about physical therapy as just basic exercises and stretches, for example. But in reality, it's so much more than that. So, can you give us an example or even an overview of some of the diverse techniques physical therapy does have to offer?
Absolutely. I think that's one of the biggest misconceptions about physical therapy. We talked about this in earlier episodes where physical therapy has become a commodity that every physical therapist is like every other physical therapist. And that's just not the case at the rehab room. Many patients envision physical therapy as a place where you go and you do a few leg raises or you stretch your hamstrings or you jump on a stationary bike. And that is absolutely not the reality. The reality is that physical therapy really is an incredibly broad and dynamic field that incorporates movement and systems and various treatment approaches tailored to each patient's specific needs. We don't just focus on pain relief as a physical therapist. We address the underlying dysfunctions that are really contributing to the movement dysfunction or the discomfort or the pain that the patient is experiencing. That might include a myriad of things, joint mobilization to restore normal function of the joint, or myofascial release to really reduce muscle tightness, neuromuscular reeducation to correct dysfunctional movement patterns, and even vestibular rehabilitation to improve balance and coordination. We also incorporate things, and I know we're going to talk about this later, really dive deep on multiple modalities that we offer here at the rehab room that many other practices that I'm not aware of any that offer hyperbaric oxygen therapy or blood flow restriction or dry needling, really game ready vasocompression, the vibeplate. What's great here at the rehab room is that modern physical therapy really is not that one size fits all approach to care. And a lot of local providers treat it exactly like that. It's highly individualized. It's really science backed. It's evidence based, and it's designed to really optimize my patient's function and long term health.
Absolutely. And I know hyperbaric oxygen therapy is something that you specialize in and is something that not a lot of people associate with physical therapy, but I know it's a big part of your particular practice. So can you tell me a little bit more about how it works specifically and why you do choose to use it in your practice?
Yeah, it's really a game changer. We talked about this before, Layla, when it comes to healing and recovery. So what it is if you're in a chamber and it's pressurized. So you get in the chamber, you lay down, you read a book, whatever you want to do, you fall asleep. You're in there about 45 minutes and we zip you up and we pressurize the chamber. And that really drives the oxygen pressurized into the cellular level. It really increases the amount of oxygen that dissolves in your bloodstream, essentially. And that extra oxygen is really delivered deep into the tissues, allowing the body to heal more efficiently and more quickly. So much more quicker recovery and restoration to wounds, to brain injury, to just muscle strain and sprains. In my rehab setting, I often recommend hyperbaric oxygen therapy, HBOT, for post-surgical recovery, chronic pain, soft tissue injuries, even neurological conditions like I mentioned, like stroke or traumatic brain injury. It really reduces inflammation, promotes stem cell activation, and accelerates the healing process at a cellular level. We talked about that at the cellular level. It's particularly useful for patients that have hit a plateau. And we'll talk about what that means. What does a plateau mean in recovery and the recovery journey? Dealing with slow healing injuries or wounds that just aren't healing really respond well to hyperbaric oxygen therapy. Many professional athletes I work with have them in their house. Justin
Wow.
Bieber has one in his house. A lot of the NFL stars have their in their house, but it's really not just for the elite athletes. It's for anyone looking to heal faster and more effectively. When we combine that with the hands-on healthcare that is the rehab room, with movement-based rehabilitation, it's really a powerful tool to restore function for all my patients.
Often can people choose to use hyperbaric oxygen therapy? Is it something they can do daily?
It is. So I just had a patient sign up for 50 treatments. So she's coming for 6 months. And you find that anything north of 12 units, 12 treatment, blocks of time, 45 minutes to an hour, really has a great effect on the patient's outcome. So I would say a minimum of 12 up to about 48, 50.
Wow. And I know you said the standard time is about 45 minutes. Can people do it longer than that, or is that not recommended?
It's
Is
not
it usually
recommended. Usually the breakdown of the equipment is that 15-minute interval. So if someone's booked for 9 o'clock, they're out by 9:45, and then we break down and clean and sterilize the unit so that someone's ready for a 10 o'clock routine.
It's awesome. It sounds like something I want to try. I would like it sounds like
You're
a good
welcome
place.
anytime, Layla.
I will definitely have to come and check it out. I know beyond hyperbaric oxygen treatments, dry needling is another thing that you tend to do in your practice quite often. So, being that it's another innovative approach that's becoming more and more popular, how does it compare to, for say, acupuncture? And when do you recommend patients use it?
I got to tell you, it's been so popular. It's rare to find somebody that's board certified and credentialed in dry needling like me, like myself. And we've had many patients just this week apply for the evaluation. They're coming in tomorrow. They're coming in Friday. And I do an evaluation and I say, yes, you are a candidate for dry needling. Not everybody's a dry needling candidate. And the only similarities, I guess it's best to discuss acupuncture and dry needling in similarities. The only similarities are the needle we use. So it's a dry needle. Dry means there's no injectable. So a needle that you get in a doctor's office, they're injecting insulin or whatever they're injecting. That's has a hollow needle to it. So this is a dry, thin microfilament needle. And the similarities between acupuncture and dry needling is only in the needle. Acupuncture, if you think about it, focuses on the flow of the body's energy. They call it the chi, and they stimulate the meridian. So they might treat your ear for your knee. Whereas dry needling, on the other hand, is really entirely based on Western medicine, Western anatomy, and neuroscience. It specifically targets those muscles that are trigger points. You've heard a lot about knots, like muscles knotted up in your upper trapezius, in your quad, and your hamstrings. So I go in and I penetrate that knot, if you will, with the needle, and it really relieves that tension and improves the movement at the joint level. When muscles are tight or dysfunctional, it can create pain or limit the range of motion or lead to chronic conditions. So by inserting the needle into that trigger point, we're causing a neurological response at the muscle level, resetting the muscle. So one of two things happen. If you have a tight muscle, a knotted muscle, the needle relieves the tension of that muscle. But if you have a muscle that's not firing, let's say specific to the shoulder joint, let's say there's a rotator cuff muscle that's not firing, I can hit the needle into that muscle and it wakes up that muscle. and it lets it fire appropriately, leading to better range of motion for the joint at that level. You see it used, I use it a lot with chronic muscle tightness, joint dysfunction, headaches, tendonitis, nerve entrapment, etc. And again, hyperbarics and dry needling are often offered to those patients who are not seeing progress. Like I have many patients that come to see me that are going to the other physical therapist down the street and they plateaued and they're coming here for a nuance, a new approach to treatment. And I offer them dry needling, I offer them hyperbarics. It's often that missing link that can't be found elsewhere to help them deal with their pain and level set around the joint and the dysfunction of the joint. I just had a patient yesterday. She came in, she was chronic plantar fasciitis for over a year. And I went through the list and she's tried everything, Layla. She had injections, orthotics, shockwave therapy, chiropractic, acupuncture, myriad of things, has not tried dry needling. Came in yesterday, assessed her calf muscles, her heel cord, has a couple areas that are really tight in her heel and in her back of her calf. Plantar fascia is inflamed. So I hit the back of the calf with a couple dry needles, hit the plantar fascia with a couple dry needles, 60%, 80% pain relief immediately. So I'll treat
Wow,
her 3 times a week for the next couple weeks and she'll be pain free.
that's amazing. I'm sure she must feel so relieved. And I know you said you hit her calves a few times. How long does that process take for dry needling?
About 15 minutes. The treatment is about 15 minutes. Sometimes I'll put stim. So I will put e-stim on the needle and that will fire the belly. You'll get like a firing pattern in the muscle and that relieves the tension immediately. So she had really great outcomes with adding stim to the dry needling, which is often a complement to the dry needling, which is like exactly like hyperbarics. It's kind of like complements the normal day-to-day physical therapy and it really adds to the recovery journey.
Awesome. And you touched on stim and adding that. What exactly is stim? Can you talk a little bit about
Yeah,
that?
so it's if you think about having like an electrode placed on the needle and you're adding electrical stimulation to the muscle belly and you'll see the muscle belly will fasciculate and fire and you know that you're on the muscle and then you'll see the tension just essentially relieve under your fingers. So I palpate, I fire the needle and I look at it and the needle's palpating, and then ultimately 5 minutes later, 10 minutes later, that muscle belly is totally relaxed and not firing anymore.
Wow, that's awesome. And instant release was great. And now I know each patient is different, but do you tend to have a lot of patients that do well from having both done? Or is it something that's done simultaneously?
I do. So then if you think about a joint that's close to the movement, so if you look at your heel cord, your ankle joint, and if I could put needles in the calf muscles as well as under the foot, that journey of electrical stimulation goes from the back of the calf to the foot. Do the same thing with the shoulder to the elbow or the elbow to the wrist or the wrist to the fingers. So if you think about if you fire the joint above the joint you're treating, like oftentimes I will treat the kneecap and then fire the quad, or treat the gastroc, which is the calf muscle, and fire the hamstring, or fire the glutes in your butt that fires the back of the hamstring. So it complements each of the joints above and below the injury.
Is dry needling something that patients can have done every day, like hyperbaric, or is that something
They
completely
could, but
different?
what I like to do is I like to give them maybe like a 2-day window between the treatments to see if there's any response. Sometimes you get bruising, sometimes you get irritation of the muscle belly. So I like to get out in front of that the first 2 weeks. But after that, they can absolutely receive it every day or every other day.
Awesome. And with manual therapy, I know manual therapy can often be overlooked in favor of machines and devices. So, what's the power of a hands on treatment and rehab, and what techniques do you personally use?
Now I'm going to get on my soapbox a little bit, Layla, if you don't mind. So
Please do.
I feel like that is such an underappreciated piece of physical therapy. It's the most powerful, I think, aspect of what I do every day. Physical therapy is physical. by design, by name, and it's physical for a reason. Every single patient that comes through my door is touched by me. Every single treatment, every single day. If it's for 5 seconds or 5 minutes, every patient, I lay my hands on all of my patients. And that's a quick assessment of range of motion or a strength test. Technology has its place. And as you know, I'm surrounded with technology as I'm looking out in my gym, but nothing can replace hands-on skilled care. Nothing can. Manual techniques. There's many, many techniques that I use on my patients that affects their soft tissue, their joints, the nervous system, that machines just simply cannot replicate. There's several forms of manual therapy I use every single day. Joint mobilizations where I get in there and stretch out the joint, or myofascial release, or instrument assisted soft tissue mobilization, ISTIM by acronym, or Graston, active release, muscle energy, a lot of terms that mean nothing to anybody. However, what it should mean to everybody that's out there that's not receiving physical therapy at the rehab room is that your physical therapist should be touching you every single treatment. That's why it's called physical therapy. Every approach to physical therapy has its purpose, whether it's improving joint mobility or reducing muscle tightness or enhancing circulation to aid in your patient's healing. Again, every single one of our patients receive hands-on healthcare at the rehab room. And I hope you out there receiving physical therapy is being touched by your physical therapist. It provides immediate feedback. If I touch a joint or I touch a muscle, I know if it's in spasm. I know if it's restricted. When I place my hands on my patients, I can feel exactly where the restrictions are and adjust my treatment that day accordingly. Patients often experience significant reduction in pain and can add immediate improvement in their muscle after just one session. So again, physical therapy is called physical therapy for a reason.
It's amazing. And being that you are, like you said, touching all your patients every day, you need to keep up and being physically healthy and being in good shape yourself. Do you use any of these
So
practices on
good
yourself?
body mechanics all the time.
Yeah. Amazing. And speaking about being surrounded by technology in your practice, I mean, we're in a world where we're all surrounded by technology all day long, and it is something that is just continuously advancing so fast. What role do innovations like vibeplate, Game Ready, or Biosway play in modern physical therapy?
Yes, let's start with, I'm looking out right now across the gym. Let's start with the vibe plate. So the vibe plate, if you think about the vibe plate, it's vibration. So what it is, it's vertical vibration, and the patient stands on this platform, this huge platform, and it does three things. So it neuromuscular activates the joints that are weight bearing on the unit. It adds and increases their balance and increases their circulation. That's the threefold effect of whole body vibration. And again, this is a unit that is very expensive and that it's cost prohibitive to multiple clinics that are surrounding me. I don't know of one clinic that has the vibe plate in the surrounding area. And that's great because my patients really respond well to it. I could put an older patient on there to work on their stability, to work on fall prevention, to work on balance. I could put my athletes on there to work on explosive power, faster muscle recovery. I could also put my patients that have neurological deficits, a stroke, or a traumatic brain injury, really benefits from that sensory overload, that sensory stimulation by just standing on the vibe plate. When you stand on the vibe plate and the vibration automatically leads to activation and co-contraction of the muscles that are standing on the vibe plate. So I could do a handstand on there, I could do a push-up on there, and that's going to activate all the upper quarter. I could do just standing balance squats on the vibe plate while it's turned on, and that's co-contracting the quads and the glutes and the heel cords. They're getting essentially more results in less time. It's general enough for post-op patients, deconditioned patients. I had a patient here last week, 83 years old, in a wheelchair, rarely ambulates. Just getting up and standing on the vibe plate just for 2 minutes led to increased circulation, increased balance, and increased muscle tone. And I have her
Wow,
on there 3 times a week, 2 to 3 minutes of time, and seeing dramatic results with that.
that's awesome. And with vibeplate, I know, like you said, you probably have different patients from all walks of life and ages that use it. Is it like the same type of frequency, or is that like adjustable, and like in terms of how long patients stay on it? Like you said, someone stays on it for 2 minutes. Do athletes stay on it for much longer? How does it work? Like the specifics of it?
That is a fantastic question. So there's very specific parameters for what you're looking to do. So if you're increasing circulation, it's just this hertz. If you're increasing range of motion, it's this hertz. If you're increasing strength, it's at this hertz. So having an athlete on there, I'm going to maximize that vibration so it really offsets their balance. But I might have an 82-year-old on there with Parkinson's who has poor balance at the lowest hertz there is and barely sensing the vibration. But just by standing on there and working on the balance, absolutely, it's firing all those muscles that haven't been fired in a long time in that bedridden or that patient that's in a wheelchair, 8 hours out of the day.
That's so cool. I know you said people can do handstands and squats on it. Do you usually advise, what do you advise, let's say, someone who is an athlete to do on there? Is it
I'll
to
have them do
stand
their
on
full
there?
program. So I have a 8 by 3 foot platform, which is extremely rare. So it has parallel bars on each side of it. So I do gait training on there. I do neuromuscular education on there. I do explosive power with my athletes on there. Just by having them on there and doing the plan of care that they would do on the mat, but on the vibeplate, exactly replicating what they're doing on the gym, but on the vibeplate by adding that vibration to the treatment plan, just really enhances recovery and expedites recovery within like a couple treatments.
That's amazing. And I know we rarely see like a lot of advanced units and other PT practices. And we'll talk about a few other ones. But speaking about vibe plates specifically, why did you choose to add specifically this to your practice?
Because it's unique in that nobody's doing it, but I know the outcomes are great. Having done the research on this, evidence-based practice around the vibe plate, around the Game Ready, and I'll talk about the Game Ready, and I'll talk about the Biodex, Biosway in a second. So I don't just add units here that are just to add units. There's many things out there that are just not evidence-based or don't have the backing that the vibe plate has or the Game Ready has or the Biosway has. The only reason I have these in here is because they work. And they work for an athlete and they work for an 82-year-old with Parkinson's disease. And that's the only reason I have them here. I don't have them to be, okay, look what I had, to be unique, to be the used car salesman of the physical therapy world. It's more of I know these work, and that's why I have them in my clinic. And they're very expensive. That's why they don't have them in other clinics. And that's their problem, not mine, essentially.
That's
And
why the
then
rehab room is the best.
exactly. And then the Game Ready, again, my experience with the Game Ready was at the elite athlete level, working with the Union, working with the Eagles. Every NFL team has a Game Ready elite in their gym. Every NBA team has a Game Ready elite in their gym. I don't know of any surrounding physical therapy providers, and if you're out there, hit me up, that has a Game Ready unit in their clinic. I sold my practice to other big box physical therapy providers, and when I was in those providers, not one time did I see a Viplate or a Biosway or a Game Ready. The reason is because they're expensive and there's not much value to a high volume clinic in that the driver is not usually the Game Ready or the Viplate. It's volume, volume, volume. And they can treat a patient, 6 patients an hour, and not have a Game Ready, not have a Viplate, and the patient doesn't know any better. So the Game Ready, let's talk about that. So the Game Ready, if you think about it, it's cold and it's heat and it's contrast and it's compression. So it's fourfold treatment. Naturally cold, going to vasoconstrict. Heat is going to vasodilate. But I could put the unit on so that I had a patient in this morning, put on the shoulder, heat, ice, heat, ice. That allows the body to dilate, constrict, and it pumps out all the edema of that joint. And then you add to that compression load, so it squeezes the joint, again, further decreasing the edema in that shoulder joint. That's the contrast part of it. And it's fully customizable. So I could put on a protocol for post-op recovery, for injury management, for pain relief. Again, here we are. So feel better faster. That's the game plan. The game plan for the Game Ready, the game plan for the Viplate, and the game plan for the Biosway is to feel better faster. Get more results in less time. That's why I do it. especially in the critical early phases of rehab or after high demand sessions where an athlete's going through an hour and a half of treatment, or a post-op joint is swollen, a total knee replacement. I have my total knee replacements on that every single day, and they just really benefit from it. And they benefit from it much, much earlier in the rehab cycle. So I have a patient here, he's 3 weeks out from total knee replacement. I have him on the game ready, comes in, his knee's swollen, he leaves, his knee's not swollen. That's because of the game ready. Game changer, absolute game changer.
And in terms of the game ready, like how does it physically work? Is it more like a wearable? Is it something you put on? How does it work?
Great question. So it's a sleeve. So it's a joint specific sleeve. So I have a shoulder joint, I have a wrist joint, I have an elbow, I have a hip, I have a back, I have a knee, I have an ankle. So based on what I'm compressing, based on what I'm heating or icing, allows for me to put that sleeve on you. So I have a knee sleeve that I put on my total knee replacements. They lay down, I turn it on, it has Velcro, and then it floods the joint, the sleeve, if you will, with that cold, icy water or the hot 110-degree water, and that circulates through the sleeve. So you have the heat come through, 110 degrees of heat, followed by 38 degrees of cold. And then you have the squeeze simultaneously with the heat circulating and the cold circulating through the joint. That makes sense?
Right. Yeah. And is that I'm sure it helps, like you said, make everyone feel better faster, which is the objective, which is great. What does that feel like on them? Is it just like a relief, or is it like a sensation that they
It
feel? Do
feels
they
it
feel
feels
much?
miraculous. I had shoulder pain last week. I went over, strapped it on my shoulder. 15 minutes later, I had no more pain. That's just what it does. So it's an amazing unit. It's been well documented for over 18 years now. This most recent unit, the Med4 Elite, it adds the heat and the ice and the compression, where all the game readies in the past only have ice. This is brand new. I'd say it's about maybe 5 years old, and it's rarely offered, but we offer it here at the rehab room.
Awesome. I'm not in any pain, but I want to try this. Fortunately, I'm not in any pain, but that sounds like it would feel great. I'm very tempted
So
to
we'll have you
visit
drive
Rehab
up here later.
Revolution.
We'll throw you in the hyperbarics, then we'll finish out with the Biosway, and then we'll wrap your joints with the game ready. What do you think?
Sounds great. I have a few days coming up. I might have to go and take a little trip. But I know we spoke about vibeplate and game ready, and you touched on Biosway, but tell me a little bit more about Biosway and how that works.
So Biosway is it's a balance and proprioceptive that's often overlooked, but essential in fall prevention, sports rehab, post-injury recovery. So it gives us real-time data. So you stand on a platform and you're looking at a screen, and then your movement on that platform is documented on that screen. So I can have a patient that has a total knee replacement. Every joint that has surgery has decreased proprioception. Proprioception is merely where is that joint in space. So I know where my knee is when I bend it. And I know where my knee is when I straighten it. I know where my foot is when I bend it. I know where my foot is when I bring it up or I bring it down. So I put them on that and they could see their progress. And I could tailor that to their training. So if I have a patient that has poor balance, I can offset their balance on the platform and we could track.
That's so cool.
It really reduces fall risks and it restores their confidence in their movement. So the patient's on the screen, they can say, oh, I see how I'm doing. I was a 6 last week. Now I'm a 10. And next week, my goal is to be a 12 or a 14. So it's not subjective. It's purely objective data. And it's wonderful in fall prevention. And like I said, anything that's lower quarter, ankle injury, knee injury, hip injury, back injury, I put them on a Biosway. If nothing, for an assessment. See where you are. Let's see where you are today, Layla. Let's track your balance. And it's poor. Our goal is to be fair. And what does fair mean? Fair is a 12 or a 14. Let's shoot for that. 2 weeks later, we jump back on there, reassess you.
Awesome. And these all sound like such cool technological advances. Off the top of your head, I'm putting you on the spot here, but are there any other treatments that you don't have yet that you're considering getting, or something you've been like researching that you want to add?
Yeah, there's the red light. So the problem with red light, when it's done right, is very, very productive and the outcomes are great. But most of the surrounding gyms really don't have true red light. So red light is very specific to what the UV exposure is, what the AV exposure is. most of these gyms that you offer free red light to have a red bulb and a tanning salon bed, and that's doing nothing. They're $85,000 each, Layla, the bed. So it's really hard to make sense of that purchase. But I was in one 2 months ago, and I came out and I just felt phenomenal. So who knows? Maybe a year down the line, we'll invest in something like that. But many clinics, at the Biosway level or the vibeplate level or the game ready level, just don't invest in that level of technology for two reasons: cost and lack of training. You have to be trained on these things. So if I invest in a game ready and I put it in this big box store that's across the street from me, I have to invest in training my physical therapists, and they don't want to do that. So I've chosen to go above and beyond by having this in my clinic, because I truly believe that rehab should be evidence-based and forward-thinking. That's why I have it. It's individualized. It's based on a care plan. It's based on what I'm trying to do with my patient's recovery, speed up that recovery. And my goal really is, with all my patients, to give them access to what they don't have access to otherwise, elsewhere. Resources that are reserved for the elite and the high-level medical centers that they don't have anywhere else. My patients come in here, they're not NFL. Some are, some aren't. But I want them to see, like, okay, that elite athlete is on the game ready. I want to be on the game ready. If that leads to his recovery or her recovery, and that speeds up that recovery, then why not put that on a 75-year-old with a total knee replacement? We're not just looking for high tech just to be high tech. We're looking for high tech because it works. It really does work. It's treating them smarter, not just harder. And that's that level of care that we believe every single patient deserves. I have a patient I mentioned earlier. He's a post-op shoulder, and I think I talked to him about him in the second podcast. But he was a patient of mine when I was working at another big box center 9 months ago. And then he followed me to my new clinic, and I put him on that, the game ready, just to feel it. Like, how does that feel? He's like, that feels fantastic. I wish you had that at the other big box store. I didn't have it because it wasn't my shop. This is my shop. And it really just complements the hands-on healthcare, the recovery, the traditional evidence-based physical therapy. I'm never going to have somebody just sit in a corner and do exercises because they want to do exercise, or I want them to do this knee replacement, that knee replacement does this 5 exercises, go over there, do them with the 8. That will never happen in my clinic.
Absolutely.
I just really, really cherish my patients, and I want to give them what's best out there. And the best out there is the vibeplate and the game ready and the Biosway.
Amazing. And I know you probably have so many patient success stories, but for someone who is listening, who is undergoing rehab, but may not be seeing results or the results they want, what would you say that they can ask their therapist about treatment options?
Yeah, so you ready for another famous Dr. Gariffo quote? So reassess, reframe, and refocus. It's the three re's, if you will: reassess, reframe, and refocus. What does that mean? So you should never, ever be intimidated that you can't go to your physical therapist directly and say, we got to revisit my goals here, or my progress is minimal. What are we going to do about that? Transparent conversations with your physical therapist every single day. Rehab should be goal driven. And that's not my goal. That's your goal. You're the patient. What are your goals? I want to lift my granddaughter again. I want to golf again. Okay, what is our treatment plan? How are we going to get there? And let's reevaluate that plan every single week. If you're 4 weeks into your plan and you're not getting any better, that's a problem. That's a big problem. So let's go back and revisit my goals. And then, are we using the right techniques? We talked about a bunch of techniques earlier on to my condition. Like, are you doing what's best for me as my physical therapist? Is there a different modality that's not offered here, that is offered down the street at the rehab room? Have those conversations with your physical therapist. Do you have the game ready? Do you have the vibeplate? Do you have the Biosway? No, I don't. Well, you know what? Give me a call, because I do. Let's have the modalities that are appropriate for our patients. Are you being touched by your physical therapist by manual therapy techniques, exercise progressing? Are you tracking my progress? Where was I 2 weeks ago? If the answer is I don't know, that's the wrong answer for the physical therapist. Having done this for 30 years, I've seen poor physical therapy and I've seen superstar, stellar physical therapy. If you're not getting the superstar physical therapist, vote with your feet, leave, go somewhere else, because your physical therapist should be tracking your progress. If there's no objective data, range of motion, strength, function, it's hard to tell what's really improving. If I don't know those parameters for my patients, I don't know if you're improving. So are you tracking the progress? And then are they there? This is not a plug for what I offer here in my clinic. This is merely an answer that I tell friends that call me that are in another state and they're going to physical therapy, and they say, what should I be asking? What are the questions I should be answering? Do they have the advanced tools? Do they have technologies that help you recover faster? Again, here we are. Game Ready, Med4 Elite, Biosway, multiple units, multiple endurance pieces, different things that your physical therapist should be doing with you every single day that aren't standard in traditional physical therapy settings. Can we change or update my plan of care? If your therapist isn't willing to adjust your plan of care because they're the expert, that's a problem. That only should be based on how your body's responding. If your body's not responding to that treatment plan, you need to adjust that plan of care. Would a referral to another specialist be appropriate? Neurologist, orthopedic surgeon, collaborate with those specialists, with the physical therapist, not just the physical therapist. I've sent my patients to neurologists all the time, or orthopedic surgeons all the time, if they're not making gains. Maybe it's something deep and something I'm missing. And I'm on the phone with those neurologists because we appreciate and we respect each other's referral. So I'm on the phone with the neurologist saying, this radiculopathy is not responding to my care. Why don't you give it a second look? Maybe order an MRI or take a look at it. Maybe there's something medicinal that you could offer my patient that I'm not offering. And they respect that referral, and they respect that referral enough to refer me patients that are not responding to other physical therapists. And lastly, can we change my home exercise program? Upgrade it. A variation to my home exercise program. You give me the stock sheet of paper that's been sitting in your desk for 6 years. Every single knee patient gets these 5 exercises. Every single shoulder patient gets these 5 exercises. I've seen it, Layla, and it exists. That's a problem. Home exercise programs should not be done in the clinic. They're called home exercise program for a reason. Do them at home. Let me do my hands-on healthcare when you're in the clinic. I told you I'd be on my soapbox, didn't I?
You
And
should,
then
as you should be.
the bottom line really is that if you're not seeing results, you deserve answers. A good physical therapist will welcome these questions and work with you to assess, reframe, and refocus and reassess as needed.
Absolutely. And I know you've worked with so many patients, a wide range of patients at that. Can you share a real success story of where one of these specific advanced techniques you've mentioned have made a huge major difference?
Yeah, so I'm gonna expand on. So I had this patient. We talked about the patient with the chronic plantar fasciitis. So she was 48 years old, and that's a different kind of paradigm as to how I would treat that elite athlete. So I had an elite athlete come in, 18 years old, fast track to all D1 schools, chronic Achilles tendinopathy. So what that means is the heel cord in the back of your ankle is inflamed, and it's acutely inflamed, and you can't weight bear on it. You can't push off on it. You can't run. So we looked at her gait. I looked at her hips. I looked at her knees, looked at her ankles. And what we did was we did a lot of eccentric loading to the Achilles tendon, dry needling. We added dry needling to the treatment plan, gait retraining on the treadmill, on the elliptical. With 8 weeks of this treatment plan, and she's been through the gamut, injections, other physical therapists, orthotics, non-weight bearing for 8 weeks. Nothing was responding. So I treated her for 8 weeks, and she was not only pain-free, but performing at a higher level than she was before her injury. So now she's at a D1 school, and she's doing great.
That's amazing. In
And
eight
that really
weeks.
speaks to the power of personalized, integrated rehab approach. I know I use my hands a lot because I'm Italian, and that's what all Italians do. We use our hands a lot. So it's shooting now below my logo here, so you're seeing my hands move a lot. So If you have any questions about that patient, I can talk to you about another back pain patient if you would like me to.
Yeah, I mean, that sounds like a great example of someone who in 8 weeks basically not only got better, but better than better than they were even before. But do you have any other specific patient that like stands out?
Yeah, I had another patient that I remember, debilitating chronic low back pain for over 10 years, multiple rounds of traditional therapy. When I say traditional therapy, I mean physical therapy elsewhere, right? That's not working. Pain medication, too much pain medication, spinal injections, scheduled for surgery, actually scheduled for surgery. And the neurologist said, you know what? You got to go see Dr. Gariffo before you have surgery. And if he can't fix it, you're going to have surgery. So she came to me, really frustrated, couldn't walk, started with a comprehensive, just really slow graded movement assessment. I found significant imbalances in her core stabilization and her hip mobility. So it was coming from her hips and the core. If you think about the core, a lot of people talk about the core, the core, the core. The core is the three B's. It's your butt, your belly, and your back. So if your core is out of balance, meaning your butt muscles are not as strong, your belly muscles are not as strong, or your back muscles are not as strong, that's the imbalance. So categorizing each of those three B's and diagnosing where the deficit was allowed her to recover. So I combined all the manual therapy techniques I talked about, retrained her movement patterns, introduced progressive strengthening slowly into the program, blood flow restrictions to the hip. So what we did was we taped the quad and we inhibited blood flow restrictions to the quad and the hamstrings, and slowly taught her how to fire the quad and the hamstrings and the glutes appropriately. Dry needling to the glutes, dry needling to the paraspinals in her back to address these chronic muscular tension. 2 weeks of that, 3 weeks of that, incorporated hyperbaric oxygen therapy into the treatment plan to reduce that systemic inflammation. 3 months later, she went on from being immobile now, to hiking with her family again, completely pain-free. For her, this was more than just rehab. It was getting her life back. And you see how, like I mentioned, the manual therapy, the progressive exercise, the hyperbarics, the injections, the dry needling, they all feed off each other and they all complement each other. It's not just a one and done, meaning rarely, if ever, does someone come in here and say, give me dry needling and that's all I want. I want dry needling. Okay, great. I don't do just dry needling. I'm going to evaluate you. I'm going to say, we're going to do dry needling and we're going to add this and add that. I don't do just dry needling. If you want to go just dry needling, go down the street, find another guy. Because it rarely, if ever, is just dry needling. Rarely, if ever, is it just plantar fasciitis or Achilles tendonitis or chronic low back pain like this woman had. So I added everything that I have in my toolbox that nobody else has, and then treated this woman. She was discharged 3 months later in tears, pain-free.
It's incredible. And you said she was in pain for 10 years prior, like 10 years before this, right?
Yep. And didn't have to have
Wow.
surgery. That's really important.
And didn't have the surgery. That is incredible. That's a whole new lease on life, especially in 3 months. That's so drastic. To be able to just do everything and be back in your own body. That must be so rewarding. Wow, that's crazy. Good for her, and you're amazing. And I know, just going beyond your patients who have been able to benefit from these specialized treatments. We know not everyone can go to the rehab room and not everyone can, really have access to specialized treatment. So for other people, especially maybe some of our listeners who can't have this opportunity, what are some maybe universal rehab techniques that they can do at home to improve their own mobility and healing?
Yeah, it's great. It's a fantastic question. I think about it that way in terms of, we talked about what a home exercise program looks like, or what a good physical therapy, quote unquote, program should look like and should feel like. Not everyone has access to the high-end rehab equipment that I have access to here at the rehab room. the foundation of recovery and mobility really doesn't require this fancy setup. It just doesn't. There's universal research-backed techniques that anybody out there listening to me right now that's in physical therapy or that's in another state that can't access the rehab room, I can do at home to support their healing, to reduce their pain, to improve their movement. Mobility is the key. Let me say that again. Mobility is the key. So you at home, you and another physical therapy provider should be focusing on simple mobility drills, hip openers, thoracic rotation, body weight strengthening, bridges, squatting, foam rolling, breath work. There's so many things that help you regulate the pain and regulate the nervous system. Simply walking. It's one of the best ways to promote whole body health. Walking is the cure. I tell every single one of my low back pain patients that as soon as I treat them, they say, can I go on my walk? Yep. Can I walk? Yes. The answer is always yes. Can I walk? Yes. 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 Mobility, walking is the cure, especially walking outdoors. It's powerful. You're getting light exposure. You're out there walking with your spouse or walking with the dog or walking with your friend. It's emotional. We talked a lot about this with episode 3 around the psychology of pain. Walking is the cure. It leads to constancy, consistency, and body awareness, especially outside.
Mm-hmm.
So the bonus of that, what is the bonus? What is the bottom line? It's all about symmetry. I had my aide come in here yesterday and we were evaluating a patient. I bring all my aides in, so I want them to experience why I'm doing what I do with my patients every single day. So a physical therapy aide is an unlicensed, non-clinical support staff. They're not a PTA. A PTA is a licensed individual, a physical therapy assistant. A PTA is not. So having the aide come in on the evaluation and talking about symmetry, simply symmetry, starting with, if I have a forward head posture and I'm kyphotic and my shoulders are forward, like I'm in front of my computer all the time, the symmetry of my body and the front of my body and the back of my body is that if I have this posture, everything in the front of my body is tight. Everything in the back of my body is loose. So what do? Bottom line, bonus is you stretch what's tight and you strengthen what's weak. Simple. Period. End of sentence. Stretch what's tight, strengthen what's weak. That is the golden rule in rehab. Tight hip flexors, stretch them. Weak glutes, strengthen them. The body craves balance. The body truly craves balance. That balance is symmetry. You don't need expensive gear to take control of your healing. You don't need an $18,000 machine. What you do need is a thoughtful routine that's done consistently, that often outperforms any sporadic high-tech treatment that someone's offering out there.
And that sounds like it would benefit anyone who may not even be specifically in physical therapy to prevent injuries, to just strengthen their body. But that's another good quote: stretch what's tight and strengthen what's weak.
Exactly.
Yeah.
It goes from a 2-year-old or a 2-week-old or 2-month-old who's not crawling to an 80-year-old with Parkinson's disease. It's all about symmetry. It's all about balance. So if you're looking at a baby, and I've done this for 10 years with babies, and they're not crawling, there's a reason why. Something's weak and something's loose. And you got to strengthen and stretch. And then teach the parents, of course. And then fast forward to a 75-year-old who is kyphotic or has poor posture. Again, strengthen what's weak and stretch what's tight.
Very, very quotable. As per usual, I'm here readjusting my posture because now I feel like I might not be on balance. But thank you so much. I think I learned so much today. I'm sure our listeners did too. This was a great episode 4. Is there anything else you want to talk about or mention before we wrap up today's episode?
No, this is really, really great episode. And like I said, guys, if you're out there and you're receiving physical therapy right now and you're too far away to come to the rehab room, you got to have these conversations with your physical therapist. You got to put them on the spot. And if they're not comfortable with it, go somewhere else.
And reassess, reframe, and refocus.
There it is. Every single treatment.
There we go. Well, thank you again so much for educating all of us today, and I will speak to you soon for episode number 5.
Thanks so much, Leila.
Thank you. Have a great day.
Appreciate your time.